I worry about Nathan. He gets lots of ear infections. When he was really little, I had to take him to emergency. His temperature was so high. They gave me an antibiotic for him, and I thought they said it wasn't penicillin. Or at least that's what I remembered. When he was 4, he came down with a really bad infection in the middle of the night, and I had to take him to emergency again. The doctor gave him amoxicillin, and he came out in this big, angry rash. He was really sick for a few days. Well, it turns out he's allergic to penicillin. I got the name of the drug he'd taken as a baby wrong. I didn't realise there are different types of penicillins. He's still prone to ear infections, but now even when I have to take him to a different doctor or he's away at his dad's interstate, I feel confident. His records are now available electronically.
My mum is in a special share accommodation place because of her health issues. It's been a bit easier as she still has her independence, but it gives us peace of mind to know that a nurse can be called immediately at the push of a button if she has an incident. Well, she's fallen over a couple of times, and when we got the call from the hospital to say she'd fallen over and been hurt again, we went straight over. I was expecting a long rigmarole of explaining her history, of running around to a bunch of different late-night chemists, of stretching my brain, trying to remember all the important stuff they would need to know. I mean, because the last time she fell over, the hospital staff didn't know anything, didn't have her tablets, and kept asking what her problems were. It's incredibly frustrating. It was a weekend and her GP and specialists were closed, and we had no idea what her medication was called. I mean, every time we went there, it was like starting from scratch. We just couldn't understand how that information wasn't being shared. But when we got to the hospital, turns out Mum had opted into the PCEHR, and the hospital had all her files, all her history on record from her GP and her specialists. Even blood pressure readings she'd been providing herself from home. She'd even been given the appropriate medication before we got there, and was quite perky when we arrived at her bedside, wondering what all the fuss was about.
I've got diabetes, some heart problems and blood pressure. But you know, I'm not going to let it rule my life. I know I should have one doctor, but that would mean I would have to stay in the one place. Nonsense. I live in Adelaide, but I spend a lot of time in Melbourne helping my son and daughter-in-law with the kids. And I spend 2 months in winter in Brisbane, staying with my sister. It's the warmth, you see. That's my ritual every year. So that's 3 GPs I see on a regular basis. I've always had to keep them all up to date with what's happening because all this diabetes stuff needs regular monitoring. I've always wished they could all share the information though, because I'm never sure if I remember it right or if I'm forgetting to mention something important that they should know. But when I joined up to the PCEHR, it all became so much easier. I'd turn up and they'd already read up on my previous consultations and what had happened, and what scans and blood tests had been done and what the results were. And I cannot tell you how much of a relief it is to be able to have all that information already there for them, including the results from my own blood sugar readings I do from home, that I now also upload myself, might I add. It's absolutely fantastic.